Health and Wellness Minister Dr. Christopher Tufton says a significant portion of the country's stock of 60,000 doses of AstraZeneca COVID-19 vaccine might have to be discarded if they're not used in the stipulated time period. He voiced this caution while speaking at Monday's virtual ceremony, where agreements with 11 private entities were signed to support the rollout of the National Vaccination Programme. Health and Wellness Minister Dr. Christopher Tufton says he's open to the idea of partnering with private entities to utilize the mobile COVID-19 units. He shared the idea while speaking at a virtual ceremony where he signed agreements with 11 private entities to support the rollout of the National Vaccination Programme.
Frankly speaking, with the addition of so many fixed sites now, the buses are more appropriate and should be more targeted on rural areas and rural communities. I mean, we had a mobile unit at Fontana, for example, on Waterloo Road, the first exposure to the branded vaccine bus, and there'll be no need for it anymore, as Fontana is a site, for example. So what we need to do is to get off the beaten track, go into those communities where logistics are challenging, where we need to convince, and bring those buses in. We would like to see over time two things, and I'm going to close now because I know the signing is ready to go. We would like to see over time these entities or others taking the vaccines to locations. So while you have fixed sites, and those fixed sites provide all the procedures, we do note that it may be easier in many instances for those seeking to get vaccinated or those we would like to convince, and we are doing that now, to go to a location where you may have 50, 100, 200 workers, for example, or a church on a Sunday where the pastor might arrange something for people to get vaccinated. We want the vaccination process to be easy. We want to take it to the people, basically.
Dr. Tufton also shared some of the set responsibilities of the private entities as they administer vaccines.
They are to counsel vaccine clients about the COVID-19 vaccine before vaccination. They are to do observation post-administration of the vaccines. They are to have systems and protocols in place to handle possible urgent adverse events following vaccination, and to secure sufficient quantities of vaccine associated with supplies such as personal protective equipment and specialized storage equipment, and to maintain a steady supply stream for the delivery of the services.
The Health and Wellness Minister says new entities should do more than just administer COVID-19 vaccines.
We would want to see these new entities coming on board, not just as administrators of vaccines, but persuaders to promote the vaccination program and the benefits of vaccines. We don't want you to just be a facilitator. We want you to be an advocate, because clearly you wouldn't be doing this if you didn't believe in the vaccine program. I'm trusting that all of you have been vaccinated, by the way. We need to convince Jamaicans